Types and locations of ports. Ports are located usually in the right upper chest, directly under the skin. You can see here's an example of right upper chest. This is an example of what it looks like under the skin. Port of Cath should be located in this area. There are older types of ports that were round with round septums. This cannot be a power injected port, and most of the time they've gone to the power ports. These are the ones that are most often utilized. They have a triangular base. They have septum with 3 raised bumps, and they are the only ports that can be used for power injecting in the CT scan. You would make sure that you have the points on the septum, a triangular port shape, device, ID card, and medical record. Do not power inject for a CT scan unless a power port device has been verified by at least 2 of the 4 requirements from the previous list. This is an example of a power lock infusion set and can only be power injected for a CT scan when used with a power port device. Examples of a couple of types of Huber needles that we have, and this is an example of the current packaging for the insertion kit. Accessing the power port. This is the lifeline of the patient. We want to make sure that we use sterile technique and that we're very careful. Access the port to determine if it is a power port or non-power port. Review the EMR if necessary. Discard all tubing used prior to the initiation of the Huber needle. Obtain new tubing and flush with ordered fluids. Document tubing changes. This is to be checked to make sure that you have an order from the physician that is in the EMR. You're going to obtain a Port of Cath kit and the appropriate Huber needle. If you're not power injecting, the VAD can be accessed with any non-coring safety needle. Choose a needle length based on the reservoir depth, tissue thickness, and thickness of any dressing beneath the bend of the needle. So when we talk about a dressing, we're talking about the biopatch. This is an example of the kit. It is a Port of Cath insertion biopatch kit. You would order this to be used for the patient. Port of Cath insertion biopatch kit. Remember that this is a sterile procedure. I'm not using sterile procedures while I'm showing this, but this is just an example of what comes in the kit. So make sure you use sterile procedure when opening the kit. Remember that the outside 1-inch edge of the drape is considered non-sterile, and that the rest of it is sterile. So what does this come with? Some gauze. It comes with a pair of gloves. I believe they are 7.5, you may have to get some out of the procedure room. This is the ChloroPrep that we would use for cleaning the patient, and this is the dressing that we would be putting over the site when we're done. You get 2 masks with this kit. You want to make sure that you have any non-essential personnel leaving the room, because you want one for the patient and one for you. We want to make sure that if you cough or sneeze or if anything, that nothing gets on the insertion site. So we're going to have one for the patient and one for you. We have 2 saline syringes. We have our biopatch, and this is an example of a Huber needle. You're going to make sure you have one of those. You don't want to put it on the kit like I just did, because it is not sterile, but the inside of it is sterile. So we're going to open up the Huber needle and give you an example of what to do. The Huber needle would be dropped onto the sterile field. It would be injected with normal saline. You're going to inject it till you see normal saline coming out of the needle tip. This is to ensure that we have no air whatsoever in the needle. You see I got a couple of drops on the sterile field. It comes with a cap. We're going to take the cap off. You would hold the area taut that you are inserting, and you would insert with a 90-degree perpendicular angle until you feel the needle touch the back of the reservoir. We're going to inject with 5 cc's of normal saline and then pull back to see if we get blood return. If you get blood return, you are good. You're going to then inject the remainder of the saline and inject with another saline syringe and put your dressing on the kit, making sure that you put the BioPatch on prior to putting the dressing on. Place a mask on the patient and a mask on yourself. Each kit comes with 2 masks. Ask non-essential personnel to step out of the room during the procedure. You're going to use your gloves. Make sure it's a sterile technique. You're also going to be using the ChlorPrep, and you're going to make sure that you're using a back and forth motion for 30 seconds. This is an example of the ChlorPrep. It looks like the ChlorPrep that we get in the IVs, except for it is much larger. You're going to use a back and forth motion over the entire area, and you want to make sure that you do this for 30 seconds. Once you get the area cleaned, you want to make sure that you let it dry. Prime the Huber needle and the tubing. You're going to palpate the edges of the reservoir, locate the flat surface, hold steady, insert the needle perpendicularly 90 degrees into the skin until you meet resistance at the back of the reservoir. Inject 5 milliliters of saline, aspirate for blood. If you have no blood return, follow the problem-solving protocol that is in the policy. Once placement is verified, apply the clamp, remove syringe, attach needleless connector cap, and attach IV tubing. Make sure that you put the BioPatch around the insertion site and then cover with a transparent dressing. The other thing you want to do is make sure that you label and date and time. Huber needles are replaced every 7 days with the dressing change. So it's not just the dressing, but it is the Huber needle itself that is also changed. Document the dressing change, cap, and condition of insertion site. Discontinuation of a Huber needle. Verify physician order. Disconnect tubing, needleless connector, and from the Huber needle extension tubing and clamp extension tubing while keeping sterile. Aspirate a small amount of blood, verify, and then inject with 5 cc's of heparin. Clamp extension tubing, remove the occlusive dressing. Remove the needle from the skin by pulling straight out from the port while stabilizing with the free hand. Place dressing, document care of and description of the site.